Hello, my name is Dr. Matthew Bosner, and I'm the Director of Cardiology at St. Genevieve County Memorial Hospital and a certified hypertension specialist. I'd like to welcome you all to our virtual Women's Health Fair presentation series. Today, I will be discussing the importance of hypertension or high blood pressure in your overall cardiovascular health assessment. Please remember to review the other topics that will be on our website in addition to my discussion today. Now, with respect to hypertension or high blood pressure is a way that we assess the strength of the blood vessels as the blood moves through your heart system. High blood pressure is measured on each visit to a medical practitioner, including your provider in the office, surgeon, the hospital for any medical procedures, or even your dentist or chiropractor. It's a ubiquitous, common, what we call vital sign, which tells us a lot of information about your overall health. A normal blood pressure reading in an adult over the age of 50 is approximately 110 to 135 on the top number and 75 to 90 on the bottom number. We define high blood pressure in an adult over the age of 50 as a blood pressure greater than 140 over 90 if you don't have any previous documented heart disease, or you don't have a heart condition such as a heart valve problem, weak heart, heart failure, coronary artery disease. To utilize these numbers, your practitioner will assess your blood pressure over several visits to ensure that your blood pressure is indeed elevated. We may also commonly recommend a home blood pressure monitor, specifically the monitors that go around your arm. Those are much more accurate and give us a lot of information about your blood pressure status. We generally discourage the blood pressure monitors that go around your wrist or on your finger, because sometimes those can be a little bit off and don't give us the necessary information to help work with you to maintain your cardiovascular health. We recommend checking your blood pressure several times a week if you're on blood pressure medications, or 1 to 2 times a month if you don't take any blood pressure medications. We define high blood pressure in an individual without documented heart disease as a blood pressure greater than 140 on the top number or greater than 90 on the bottom number. If you do have heart disease, or you've had a previous heart procedure such as a stent, bypass surgery, a stroke, or vascular disease in your blood vessels of your arms or your legs, we recommend a goal blood pressure of less than 130 on the top number and less than 80 on the bottom number. In adults greater than the age of 50, we really focus on the top number. The top number is most important and the greatest correlation with heart attacks and strokes in the future. That's why we like to push that top number down, especially if an individual has had a previous cardiac event. After your blood pressure is checked several times and confirmed that your blood pressure is elevated, your practitioner will generally recommend risk factor modifications prior to medication therapy. This will include walking, exercise on a regular basis, greater than 30 minutes at least 5 times a week, and changes to your diet, including no additional salt to your diet, abstaining from foods that have an excessive amount of salt, and general approach to your weight status. When we discuss exercise in and of itself on a regular basis will decrease your blood pressure, in addition to lowering your weight, which will also help decrease your blood pressure. But if you notice when you start walking on a treadmill or walking with your friends at the community center or in the streets of St. Genevieve and check your blood pressure, it will generally go down independent of weight loss. So exercise is an excellent method to control our blood pressure. After a period of time watching the salt in your diet and abstaining from significant caffeinated foods and exercise, your practitioner may recommend a medication for you to help control your blood pressure, and you will need regular follow-up for this. It takes about 2 to 3 weeks for any medication to get stabilized in your system, so they will likely have you call back with your home blood pressure readings or have you come back into the office to have your blood pressure monitored by the practitioner or their staff. If you need additional medications, specifically if you require greater than 3 medications to control your blood pressure, it's recommended that you have a visit with a certified hypertension specialist or cardiologist to help regulate your medications. This is a very common practice, and we work in concert with your primary care provider to help protect you against future cardiovascular events. So in summary, I'd like to again thank you for participating in our Women's Health Fair for 2021 on a virtual program, and please review the other seminars that we have listed on our website. Please remember to have your practitioner, including your dentist, chiropractor, or other healthcare providers, check your blood pressure on every visit. And if it's consistently greater than 130/80, if you have previous heart documented condition, or if it's greater than 140/90, if you do not have a previous heart condition, please consult your provider to help you in the management of this important condition. Thank you and have a great day.